Botox for men, Dysport, Daxxify, we call it Brotox. It's on the rise. Do you guys see a lot more men in your practice these days?
Yeah, no, it's interesting because I actually have seen male patients coming in for years for this. I think it may be also that men are more open and talking about the fact that they're getting Botox and other things, different facial treatments, etc. Used to be kind of a secret that you'd bury and never tell anybody about. But now they're, comparing notes with their friends. It's a good thing, of course, because there's no reason to hide it.
Yeah, it's definitely growing. I see a lot of guys being brought in by their wives,
Yes.
Wives have been coming to us for years. Husband starts to age a little bit.
Yeah.
She drags him in there and we treat him. And just like for women, Botox is a good way to dip your toe in the water. You're not necessarily liking what you see in the mirror anymore, and you just want to kind of get a feel for things. It's a good way to get started.
Are you seeing any different areas that men do versus women, or how are you guys seeing that?
Men are just more perceptive. Maybe this thing with the pandemic has had huge influence because of all the Zoom, and people see themselves on camera.
Not just that, but we were talking about influencers earlier.
Right.
There was a big, a lot of publicity around the way Brad Pitt looked at the U.S. Open recently. I don't know if you guys saw that, but Brad looks great, and as a plastic surgeon, I was looking at his images and thinking, okay, Brad's seen somebody. It looks very natural. He looks just as handsome as he ever has, but I think that after some other guys start to see how good Brad Pitt and some of these other aging actors are looking, we're going to be seeing more guys.
Because for a while, the tabloids, both men and women, showed only the bad things. But of course, in whether it's surgical or non-surgical, the ones that you don't see, that's the good work.
Right? That's the thing. Nobody ever talks about really, really well done plastic surgery, right? But I think Brad Pitt's a great example of that.
Right.
Now, because men's muscles are stronger, we were always taught you need to use higher units, more dosing. But in my practice, I find that when I do that, men can look a little bit feminized. What's your take on dosing Daxxify, Dysport, Brotox?
Oh, absolutely. I start off gently with men. Well, I start off gently with both. I'd much rather my first patient treat them, come back a couple weeks later. It's better for the patient because then you can fine tune it.
In men, the eyebrow naturally sits just a little lower than you want to see it in women. And if you're a little too aggressive with the Botox, it'll sit even lower, and then they look more tired.
Right. Or conversely, it comes up too much, and then they generally don't want that.
It's a balance.
Right.
Well, for more information, check out theplasticsurgerychannel.com.